Yep. So I can do this with gloves on or clean, dry hands. I'll put my gloves on. But my gloves have not yet touched the patient, so I'm clean. So I'm going to take this, I'm going to use my index finger and go around. Get my crown and bridge scissors. And I'm going to cut. Now put that on the tray, and that is clean, okay? So the assistant is going to place the retraction cord, dentist will remove it, okay? I'm next going to put my adhesive on my tray. The adhesive, remember, you're supposed to use the one specific to the material you're using. This one comes right with the kit. You must be able to smell it, right? Can you smell it sitting there? Okay, we're gonna put that off to the side so it can dry. Again, I am not contaminated yet. And I'm going to dispense my catalyst and my paste. What do I just need to be careful of?
They're not mixing.
They're not touching, right? You only need like a 1/2 inch, if that. You don't need a whole lot at all. Thank you. So just make sure that they're equal amounts and that they're not touching. Okay, and then I have my syringe that we're gonna backfill. So you just take that apart.
You just meant to make that noise again.
Yeah. When you backfill, remember, just like when you did it before with the cements, you're gonna go with the flat edge, drag, go over it, down, over, down, and then you can tap it to get it to move down a bit, okay? All right, so I'm gonna place my cord. So we're going to start on the buckle and end on the buckle. So you're gonna hold this in a pen grasp, and you're going to roll it right down into that sulcus. Now, if you have a lot of excess, you can cut it. Make sure, again, it just slightly overlaps. So I would want to make sure that my scissor tips are pointing up. So that I do not cut the patient's gingiva. Okay, so cord is placed. Now I'm going to start mixing. So how long am I mixing this?
Until it's homogeneous.
Right, till it's homogeneous. So you want to gather it. You can see I kept it pretty much in one area on the pad. Gather it all up. Get what you can off the spatula. I'm going to go over, down, drag. Over, down, drag. Over, down, drag. You're going to pretty much try and get all of that material. And then I'm gonna wipe around the edge there. So the dentist is going to remove that cord. I'm going to pass that off. And then I am going to immediately start mixing my putty. So you need probably about a half a scoop of each. I had way too much this morning, so we'll see if the half scoop cuts it. Half scoop is too much, I'm going to tell you 3/4. So you want equal amounts. We're going to mix this until it's homogeneous. These nitrile gloves are fine. We're going to roll that out. Yeah, that was funny. Yeah, so just like a half a scoop is plenty. So like a 1/2 inch and half scoops. Okay, I'm going to pass that off to the dentist. She's going to place it and then I'll hold it. Okay, so she's got it placed. Thank you. Now I'm going to hold it and I'll be able to remove it. Okay, and then we'll start cleaning up and then you'll switch. Okay?
Miss Ferris, is it really that easy to get the retraction cord in the sockets, or do we need something to open it up a little bit?
That depends on the tissue. Like some, you know, if they have really healthy gingiva, it can be a little bit more difficult. Sometimes though, while they've been working on it, it's kind of opened up a little bit. You know what I mean? Some of these have really been manipulated quite a bit. So like if you tried to place it on this one, which you can practice if you want, this is a little harder to get it in. The gingiva is not as, doesn't let it go as easily as this one did. And some of these we were saying are kind of chewed up, like some of your models people have used and abused the gingiva a little bit. So there's cuts, so it might go in a little bit easier. But it honestly depends on the tissue health of the patient, how tightly bound it is. So this is obviously going to take a bit longer to set here than it is if it was in the patient's mouth. Might want to stop